Hello. Hi, everyone.
Hello.
Yes, can you hear me?
Yes,
Yes, I can hear you.
I can hear you.
Okay. Sorry for the 2 to 3 minutes, no, actually 5 minutes delay to start. And thank you so much for joining the call. So as you probably have had via email or texts, we wanted to quickly give you an update on what we are planning to do within the HealthTech Hub Africa 2024 Innovation Challenge. But before we go to that, I want to do a small introduction. For those who don't know me, my name is Olivier Habumugisha. I joined the team recently, 3 months ago. I'm the new director of the HealthTech Hub. So I'll be supporting on the coordination of different activities related to the operations of the hub. So that's for those who don't know me, especially the 2022 or 2023 cohort startups who may be on this call. I think the 2024 we have been on few calls, so I guess quite familiar. So I'm from Japaigo. Japaigo is the new operator of the hub, replacing Bridge for Billions, which used to be the custodian of the hub for the last 2 years. We are working with a team from Kenya as well, Vigro Africa, which you will hear more from moving forward. They will be supporting on this component as well, with supporting on the preparation of the call, but also the due diligence and the disbursement of the grants in the later stage of the process. So without much details, I would like to start the presentation and giving you an sorry, let me share my screen. To share screen.
Now, Olivier, you can be able to share screen now.
Okay. Okay. Yeah, that's something else. I share my screen. Okay. Great. I hope you can see my screen.
Yes.
Let me know if you can see my screen.
Yes, we can.
Okay. Okay. Fantastic. So yeah, so as you've probably had, we're launching the Innovation Challenge. This is one of the 5 pillars we have for the HealthTech Hub Africa. The first pillar being the accelerator program that we run for 8 months. Second one being this Innovation Challenge. We also have another pillar around the policy blueprint. Is the 4th pillar that we are launching this year only for the 2024 cohort, which is the Standards in Interoperability Lab. I think the 2023 and 2023 cohort, you will hear more about this later. But this is a new component that we will be implementing in 2024. And then the last one, which is focusing on events, partnerships, and networks, which I think you're quite familiar with as of now. So within the innovation challenge session, pillar, for 2024, we're looking at basically, this is the general idea, the general concept of the innovation challenge, which is looking at how do we supporting HTHS startups to validate and fast-track their solutions within local public health systems, whilst generating use case demonstrations for evidence-based policymaking. So this is basically, this is not a funding opportunity. It's not a seed funding. It's not a Series A, Series B. This is not. It can be if you want to look into that direction, but the main purpose of the innovation challenge is to support startups to address priority problems identified within the public health system, propose a solution, and then with that proposed solution, the hub provides funding and capacity building for use case development. The funding is, of course, provided through the innovation challenge and the capacity building through the accelerator program. And with that package, we hope to have demonstrations at the end of the program. And those demonstrations are in a few areas. One, we are looking at scalability. How does the solution scale, realistically speaking? Two, what is the policy measures that we can learn from or that we can maybe support to inform, and what kind of improvements that we think could be done. Then we take those inputs, those demonstrations, we take them to our third pillar of the program, which is the policy blueprint. And there we have in the policy blueprint government of Rwanda, Kenya, Ethiopia, Senegal, different governments that are interested in improving the health tech innovation ecosystem. And they would like to learn from the startups, what works, what doesn't work, what kind of policy improvement. We take those learnings and gaps to the policymakers. There we do a detailed process mapping to really understand what is the element that is really streamlined quite well, what are the gaps that we believe are there. And there we also identify success stories, challenges, and gaps that could be addressed, and take those inputs to the intergovernmental working group for peer learning. As of now, our intergovernmental working group is looking into 3 areas that are the main topics. One is on data for decision making. We have the public procurement for innovation, and we have also another element around the policy angle. So, and then with that, we also have an annual policy summit as a platform for dissemination and advocacy, which is a culmination of all the engagements that have been taking place through the AWG, the Intergovernmental Working Group, for dissemination and advocacy. So, and that comes again to the startups and say, hey guys, this is what the policymakers are saying. Can you take this as a challenge for the next year and then do another challenge based on those learnings and gaps and priorities? So that's how the structure is or should look like moving forward. So within the 2024 challenge, we have a few priorities that, objectives that I think would be great to take into consideration while we are applying. One, we want to align the solutions with the public sector priorities. That's quite important. Very huge objective to ensure that if I'm working in Kenya or in Rwanda, my solution is addressing the priorities of the country. Sometimes the priorities of Kenya might not be quite different from what Rwanda or Uganda is working on. So you might find a lot of overlaps in terms of priorities, but it's important that we understand what kind of priorities our countries are addressing. And then develop solutions or use cases as we frame them based on those priorities. Second one is to catalyze the development of scalable health tech solutions, which is, I think is quite important to ensure that instead of navigating through, spending 2 or 3 years to develop a solution, how do we fast track this process? How do we ensure that we bring policymakers on the table, partners, funding, capacity building, and be able to produce a use case within a short time frame? That's the second objective we have here. Third one being, of course, the partnerships to ensure that we can, foster more partnerships within our health tech startup community to ensure that more people are able to, partner with you guys. Because if you manage to demonstrate that something works, more people would be interested to partner and will be interested to align your solution with their priorities, which is quite important. Then the fourth, which is one of the end goals, is to support the real-world demonstrations of innovative health tech solutions. So this is moving from theory and moving from the product angle to the solution angle. What is that? How does that product solve a solution? I mean, solve a problem, a concrete problem. And by that, that's what we mean by use case. So a use case means we actually have, you can actually demonstrate how a product is able to address a concrete challenge within the public health system. And with that, we can not only support on scaling this solution, but also inspire other similar solutions within the same context that are in the development, and also inform the policymakers on the gaps and improvements that are required to take it even further. That's of course what I just talked is the fifth one, which is about generating insight for the regulatory barriers and facilitators, which is quite important. Then the last one, but not least, is to foster collaborative learning across the cohort of winners. So if I manage to do this and I learn from that, how do I ensure that there is this kind of peer learning across cohort members, so that it's easy to develop more solutions much faster, much easier, and better. So that's on the objective side. So we're looking at 3 very simple criteria. One is 2023 or 2024 startup or scale up. So yeah, of course, if you dropped from the program, then it might be a challenge. But if you graduated from the program 2022, 2023, and 2024, then you are eligible. The second one is to have not received funding. This is for the fairness. If we only target the best, which I think we believe have really great solutions, then for the sake of being fair, it would be great to also extend this to those who have not yet received funding from HealthTech in the past. That's why we had to put this criteria. And then the organization needs to be operational as of 2024. So that means you have not closed and you are reopening your company just because of this challenge. Then we have the innovation criteria. Here we're looking at a few elements. One is the innovation and impact. How radical, how interesting is your innovation within the sector? Of course, the more complex, the more deep your innovation is, the better, because that means it's addressing real and very challenging problems. And then the second one is the feasibility, because all this is nothing if you're not able to actually fast track in the solution. So we're looking at also the feasibility angle. What is that realistic objective that we can achieve within the next 6 months with the right funding and the right support. Then the third element is looking at the scalability and sustainability. How likely is this solution to scale? That also could look at the private capital angle, because if it can scale and it can sustain itself, it means it can also attract more funding in the future, not just HTHA funding. The collaboration partnership is another element which is crucial for not only feasibility, but also scalability. Same with compliance. How likely is the solution to comply with the local or regional regulations? And also, how does it align with the national digital health strategies? So this is quite important, because it can't work if there is no compliance. Compliance is by far the biggest risk for any digital health solution. So this is why we had to put it into one of the main criteria. And another element is looking at the clear success definition and measurable outcomes. So here we're looking at the monitoring and performance management aspect. So how do we track the progress? How do we define the success? What is the end goal? The clarity of the end goal, how does that look like if we want to do that? Then the collaboration partnerships is another element that it would be important to cover as of now, to ensure that there is strong strategy around having more partners and collaborators to ensure that the solution can scale. So before I go to the next stage, I would just want to check if there is any question that we should be addressing for now regarding the criteria, before I can go to the tiers and other things that are related to the challenge. Is there any question?
Hi, Olivier. Can we just go ahead and speak?
Yes, absolutely.
Okay,
I can
great.
see
Hi.
my chat. Yeah, so yeah.
Sure, no problem. My name is Folake Owodunni. I'm the co-founder of Emergency Response Africa. I just have a quick question around kind of the deliverables expected within a 6-month time frame. Of course, we all know that that's fairly short as far as a health innovation goes. Are there maybe further sort of expectations or guidelines around proposing something that can realistically be achieved within that time frame? I don't know if there's any sort of more information that you can share on that. My concern is just, it's quite short. What are you really expecting to see?
Yes, thanks so much, Folake. Yeah, so this challenge is designed in a very inclusive aspect. There is no strict end deliverable, I would say, within 6 months. So what we're looking at is a use case development and the ability to produce evidence or demonstrations of what works and what doesn't work within 6 months. What we are not defining as of now is how that looks like precisely, because we understand different countries have different contexts and priorities. Use cases can be anything, like literally anything, if you put it in the context of the innovation ecosystem. There are some use cases that can be developed as like in 1 or 2 months. Other use cases can even take years to produce. So to us, this is yes, a challenge because it's a very short time frame, but it's also an opportunity for startups to think how does my solution address the public health challenges? What kind of use case that I am able to realistically produce within the next 6 months with my solution, or partnering with an external company that is able to support on developing this use case faster so that we're able to deliver this within the next 6 months. So that's to me the creative element that needs to be put in place to ensure that we're able to meet such a timeline. And for that, we are not really strict on what is that end product, a part of course, the demonstrations that needs to be taking place on, and the learnings. There is no strict deliverable, I would say, that we have from our side that each company must address within the next 6 months. I'm not sure if that's clear.
Thank you. That's helpful.
Cool. Yes, I can see someone have, I don't see the name. I see global preeclampsia. Maybe you can unmute and ask a question.
Okay, thank you so much, Olivier. I'm Abakar Suleiman from Global Preeclampsia, Uganda.
Yeah.
So we're addressing high blood pressure among pregnant women. So my concern is collaboration and partnerships. You talked about evidence of past and future collaboration with relevant public sector stakeholders. So in that case, you'll be able to...
Not sure if it's me, but
there's provision in the application where we upload those evidences. Yes, I'm saying that when you have those evidence, after explaining in the form, in the application process, is there any provision also to upload those evidence? For example, MOU signed and other things.
Yes, so there is in the application form, we have a field where you explain what kind of collaborations or partnerships you have already, or if you don't have them, you can also stipulate a plan how you intend to have them. There will be a process for due diligence whereby we verify if you mentioned you have partnerships. We have to verify if those partnerships are already in place. We don't have to go into like deep verifications, but it should be a proof at some point. If you say I have an MOU with the MOH or the regulatory agency in my country that will ensure that I can move this solution much faster, then I think this kind of evidence will need to be produced part of the due diligence process. It's not at this stage, we're not requiring it, but later when we believe this is something that is meaningful, that has potential, then we'll be requiring those evidences to be submitted.
Yeah, thank you so much.
Thank you so much as well. Then there's no other question. Is there a question on the chat that I probably forgot to address?
No question.
No question. Okay, cool. So we can go to the tiers. So within the challenge, we have 2 tiers. So the first tier is looking at the scalability angle. So this is something that is only for the scale up. So if you're already in the HealthTech Hub, you've been part of the HealthTech Hub, you know which category you are part of. We have 2 categories usually: the growth startups, scale ups. So if you have been part of the scale ups, then the tier 1 is for you. So this goes into the main objective is scaling impact. So we assume the solution is already working quite well, needs a few tweaks, and also the use case can immediately piggyback on the solution that is available. And you need $100,000 to up to $100,000 to develop that use case that uses the same solution to demonstrate how this could look like in the public health sector. So not just the growth startups, but also some scale-ups that believe maybe we need to have a a new solution that needs further validation, that needs a lot of testing, etc. Then this is something that is for you. Then we're looking at an MVP at some point. So use case, but at the MVP level, not really scaling as in we have already a use case that is ready and we want to scale that, but we actually building that use case and having one or two big group users, onboarded as an example, and be able to produce demonstrations at the micro level, how this could look like when it scales in the public health sector. So this is something that we believe a lot of people will be interested in. So with that, it's important that when you're applying, you pay attention to which category you are part of, and that you also you don't go beyond the budget that is allocated for each tier. So if you are applying for tier 2, you tick tier 2 in the application form, and your budget application form, the budget template that you downloaded doesn't go beyond the threshold that is set for each tier. So the challenge tracks. So we have 3 tracks that it's important to understand each of them. So the first one is the access track. So within the access track, we recognize that many people face challenges accessing healthcare due to geographical, financial, and social barriers. So this is a huge problem on the continent, and we believe digital solutions are able to address that. So new technologies are enabling these kind of solutions by providing things like access and affordability of care for remote and other subpopulations. So these are the kind of solutions that are using technology to basically democratize the healthcare, ensure that many people are able to get it at an affordable cost. So most of the companies in the telemedicine services or person-centered financial transactions are in this category. And then the second track is the quality. So here we're looking at, with the quality, it's we're trying to address the issue of poor quality. So that being an issue across African health system, with more people dying due to the lack of quality than the lack of access. So how do we ensure that more people are able to get better quality healthcare service? And this can be very broad. So it can range from, say, healthcare, health worker learning, performance management, data quality, effective use and continuity of care, and rental linkages. So anything that we believe will be able to unlock the potential for the system to improve its quality of service. This falls under the quality track. So I think there is plenty of examples that you can think about in this domain. Then the third element is looking at the what we usually say kind of customer service, customer care, client-centeredness. So here it's important that we understand that it's one of the main. Healthcare performance and success starts with the personal success, like the patient satisfaction on the service and alignment on what the system is providing. So solutions here are demonstrating a deliberate focus on the experience, the client experience of care, including empowering individuals to actively participate in the healthcare decisions, prevent and manage chronic illness, receive personalized healthcare information, and provide feedback to improve service delivery. So these are some of the examples that can fall under this track, but of course it can be more. So anything that we believe is addressing the patient experience is automatically falling under this track. So that being said, this is the 3 tracks we have here are not, you can see there's so many overlaps between the, if you say client-centeredness, quality track and access track. There is a lot of overlaps that, that we can observe there. So what we believe is important to consider when we are applying is to look into the USP, that unique value proposition the use case will be providing, the main purpose of the use case, that core element that if we say one thing that this solution is able to address, that's where we can now identify what kind of track our solution falls into. Otherwise, we might find that in a situation maybe data solution that is also addressing maybe the solution, it might also fall under the quality track because it's trying to address the data integration or data structures to ensure that we can be able to have better, a better quality of the healthcare service provided. So that's up to you to decide based on what you believe is your main USP, your main goal, your main competitive advantage of the solution. But for us, we are proposing these 3 tracks as the main elements for this challenge. In terms of timeline, maybe before we go to the timeline, I wanted to ensure that we have also questions, then we can address the timeline later. Is there any question?
Yes, Olivier, we have questions on the chat. I don't know, maybe if Ahmad can go first, if he has a question, but maybe it would be better if you can ask it from yourself.
Okay. Yeah, we can first take the question here and then we'll go to the chat later.
Okay, so maybe I can ask, so Ahmad asked for scale-ups, can you use the 100K in further clinical validation of the solution or just scaling the implementation of the solution? Olivier?
Yeah, so I think, the clinical validation of the solution can be only if one is in line with the use case development process. So that means we need the clinical trials, and we believe this is in line with the use case development and validation. But 2, we need to also look at the timeline. If this is something that can be realistically be done within that time frame. If that's feasible, then yes, to me that's not a problem. But we need to pay attention on the feasibility angle of that and the regulations compliance. So we usually with clinical trials tend to take a bit more and more time and also more processes in terms of regulations and compliance before we can get to the end objective. But that's up to you to motivate how this can look like.
Can I go next now?
Yes, if there is no other question on the chat.
All right, so the question is simple. So a good health system, my name is Joseph Lowe, founder of Dr. Connect. I just wanted to, a good health system will cut across these three track, because there's everything, there's in every track, there's things that we put together to form the healthcare system. So when we present our solution or our idea, are we going to be pinned to a track, or they're going to just evaluate the solution based on the solution itself, not try to pin it to a track? Is that question clear?
Yes, yeah, that's clear. So I think the latter is correct. So it's primarily the solution itself. The track is to help us and also the partners understand what is the main purpose of the solution. So it's on the strategy angle to support us to understand what are we trying to address with this kind of use case. But the evaluation itself will look at the solution, not the track, as in there is track-related measures that will be done. That's not what we're looking at. We're looking at the solution itself using the criteria that we stipulated in the last section, and the track is allowing us and other partners that we're onboarding to understand what is that concrete element that the solution is trying to address. Is that clear?
Fantastic.
Cool.
Thank you.
So, great, thank you as well. Jelle, can you go next?
Yes, thank you for the presentation. So I was wondering, maybe I missed it, will there be a winner selected for every track, or one winner at all?
You mean winner was selected for each track?
Yes, so will there be like one company selected for client-centeredness, one for quality, one for it's more about the strategy behind it?
No. So I mean, the tracks are only for information and onboarding for partners. So there is nothing of selection based on tracks.
Okay.
That's not part of the process as of now. Of course, we have limited awards, so it's not like we are going to be awarding everyone who applies. So we have limited awards, but those awards will not be. There is no quota for each track that we will say, quality has more awards than service. No, that there is no such a element in the process. Okay.
And how many awards are there?
Well, for now, we're still deciding. We will let you know. It's still an internal discussion. Yeah.
Perfect.
Olivier, there's one more question from Benson on the chat.
Okay. Yes. Public sector is broad. Is there any preference as per type of public sector level implementation? Even public facilities. So, I mean, our strategy has been quite clear since day one when you talk about engagements with the public sector. So here we're looking at national governments mainly. We understand that some countries are really, sophisticated, like we have to address county governments and municipality governments. So here we're looking at national governments. So the national priorities in terms of MOH and other national priorities. And of course, there is also an element of the regional element, but that's not part of this track. So for this innovation challenge, we're looking at the national level. We might have some correlations to internally to kind of contrast and compare the different countries and priorities and use cases being developed for our intergovernmental working group. But when it comes to developing concrete use cases, we are referring to the national strategies, not the local county governments or municipalities or public facilities. Benson, is that clear?
Yes, very clear. Thank you.
Cool. So So, Hele, is it a new hand or is it an old one?
Sorry, old hand.
Okay,
Yes.
cool. So in terms of timeline, we have a very tight timeline, at least for the initial launch phase. So at the moment we launched our application, the challenge application on Monday, so that's April 8th. I will be closing it on April 30th. So we believe that you guys will be able to submit your, documents, inputs by then. Then after 1 week, we'll have all the winners selected. So we're putting also a jury that will be ready to ensure that we have all the winners selected by May 7th. And we'll conduct the due diligence and have the winners announced by May 17th. So we will be announcing winners after conducting the due diligence and ensuring that we have everything in place. And by end of May, we hope to have all contracts done between you guys and Vigro. And after that, that's when we can disperse the funding. So it will be a milestone funding, a milestone-based funding. Means we will have to identify completely which milestones we're working towards and be able to agree on how the funding can look like to ensure that we can also be accountable on the milestones and achieve some realistic goals. And that's why you saw the milestones element in the you saw the milestone element in the sheet, so that we're able to clearly define how that looks like, and this will shape the contracting process. I mean, to make the whole contracting process much easier and faster if we have clarity on what will take place. Is there any question?
I have a question regarding the criteria you're going to be following. Given that it's public sector solutions, or rather public health solutions, how are you going to look at sustainability? Is it through the partnerships or intrinsic sustainability by the solution itself? You can guide us further on that. Thank you.
Yes, so partnership, I mean, the success to us is broadly, that's the ability to be able to demonstrate how the solution can work in the public health system. What is the potential of such a use case to address a specific challenge? So that's the broad success, I would say, from our side in terms of project management. Concretely, how that looks like, that's up to you to define exactly. So one of the elements that we put in the criteria is to be able to have clear success definition and measurable outcomes. So means whatever use case you're proposing, it's important that you can clarify exactly what is the impact that this is going to produce and what kind of success parameters the use case will be able to provide. And of course, a few KPIs. So there is no universal way to shape this. This will depend on each use case.
Thank you. Thank you.
Hi, Olivia. Thank you for the presentation. I just have a question. How many startups are you looking to onboard for this round of application? Thank you.
Yeah, I mean, that's a question that we say is still being discussed and addressed in terms of how many awards will be provided. For context, last year in the 2023 Innovation Challenge, the Hub provided, I think, was 6 awards, right? 4 awards. Yeah, so 4 hours were provided to startups. So that to me, that's something that will be changing. We might go higher, you might keep the same number, but it's something that I think is being discussed at the moment. And we also depend on how many people apply and what kind of quality use cases we get.
Then one unrelated question: how many use cases can a startup submit to this challenge? Is it possible to submit more than one?
No, that's only one. So
Noted, thank you.
yeah. Yes, we are only eligible to have one application. Yeah, and also it needs to be tied to the at some point to the product that you have. So you are free to partner with an external organization if you believe they can add value to the use case. But it's important that this sticks to your main business or your main product that you provide as a startup or scale up. Yes, Nasser.
Olivier, thank you so much for this great presentation. My name is Nasser. I'm from Guinea-Conakry. So in which format we need to present these use cases?
As in reporting or application?
As in both reporting and application.
So the application is just an online application form. So there is no proposal or something detailed that you need to submit at this point. Within the application, you'll be developing a budget that shows the different milestones towards the development of the use case that you believe need funding. And later on, once we select your use case, then you'll be providing reports on how far you with the development of the use case that you proposed. So that's a report that will be provided, that will be providing on a quarterly basis usually. And of course, there is a regular support and check-ins with the team, the Vilgro team, which will be ensuring that you're on track or that if you need support or if there is anything else that the hub can do to ensure that we can fast track the development of the use case. The team will be doing these kind of check-ins to ensure that we can provide such a support in a timely way.
Is a use case, thank you, Olivier, is a use case a plan of something that you want to do and you don't have the means to do it, therefore you design it, or at least you put together a proposal that you can submit so you guys can fund it to, it could be something in partnership with the government, something for clients that you wanna build. Is that correct?
Yes, absolutely. I mean, that's also a very good question. So use case is basically like a project, an initiative addressing a challenge that you believe if you use your solution or your solution plus another external solution, you will be able to address this, including governments and other partners that you believe will be able to support to get to solve that challenge. The challenge needs to be in the public health system. That's quite important. And that's why if you talk about public health, that's when the government is important to be part of that process, because public health, always government has a role to play in that ecosystem.
Thank you so much.
Cool.
Thank you, Nasir. Olivier, there's a question on the chat from Ahmad who's asking if the HealthTech Hub can facilitate introductions to relevant public agencies in Rwanda.
Absolutely. Yeah, so that's one of the main goals. So if you don't have, for instance, partnerships and you believe this will be crucial, not just in Rwanda, by setting up this policy blueprint, we also engage in governments in different countries. And there we're looking at how likely are those governments to partner with our startups, developing concrete use cases. So if we have a concrete idea of a solution we are working on, then we can definitely create those linkages and partnerships with the government of Rwanda, the Minister of ICT or the Minister of Health, and also in other countries that you believe will be important. Great. So is there any last question? Okay. Nasa, is it a new hand or you?
Yeah, just one final question, but I'm happy to let Elvis go because he has not spoken yet. In the interest of time, I will go after him.
Appreciate that. Yeah, thanks so much. Yeah, quick clarification on the kind of support that would qualify under collaboration partnerships, specifically on letter of intent. Would that be substantive support for this?
You mean the hub providing support?
Correct, yeah, letter of intent to partner, not necessarily an MOU, because I reckon would have till the deadline to have this information.
Oh, okay. Yeah. I mean, yes, I think we don't, in the application form, there is no mandatory element that we need to have an MOU with those entities. But if there is any formal evidence that there is commitment from players to partner, then I think a letter of intent will be enough.
Okay, great. Thank you.
Is it okay, Olivier, if I go with my question, Nasser again? So, Olivier, two further questions. The first one is, do you have technical support for use cases that requires some both funding but also technical support, such as software engineering, or product managers that can help? That's the first question. And the second question, I really apologize if I missed this information. Where can we find the application and when is the due date of the application? I'm sorry if you have talked about this already.
Okay, maybe for the last one, I will ask Victor to paste the link in the chat again for the application form.
Yeah, so if you go. So I've shared a link in the chat, but then also just in the interest of the conversation, we'll make sure to share a reminder via email with the application and the challenge. So be on the lookout on your emails in the next few hours. You should be able now to find an email now with more information about the application. But now, in the interest of time, I had already pasted the link on the chat. Let me just share it again one more time.
Okay. Then for the first question, currently we don't have capacity to support on the engineering aspect of the use case. And one of the assumptions we have addressing that is that the funding provided mostly should be covering such kind of resources in terms of getting in software engineers or digital resources that we believe will be critical to develop such use cases. So that's not something that we are offering outside the funding scope of the project. That being said, I mean, the Vigro team will be supporting on the business aspect of things. So if we need, for instance, strategy support or partnership support, linkages, networks, etc., then the Vigro team will be able to support on that, because that's pretty much generic. There is no sector-specific element. So that's something that we have at your disposal that will be able to support on making this project successful.
Thank you so much.
Cool. Any question? Any last question that we should take before we close? Okay, silence means no. So thank you so much, guys. We really appreciate your time to attend this call. again, kindly reach out to us anytime. I'll be sharing my email later, but you can also reach out to pretty much everyone from the team if you need any support to apply. We are just an email or text away. We will be providing more updates if there is any change, but as of now, we are set to close this in 3 weeks, April 30th. So make sure that you apply way before. You can always start small and save your draft and refine it, get more support, and submit it before the deadline. If you need also to engage on other components of the program, we have other elements coming on your way very soon, including the fireside chat. So we want to really ensure that we don't go just in this innovation challenge elements only, but we actually create a community of innovators who are trying to solve concrete problems within our ecosystem. So we'll be having more community engagement meetups to ensure that you are able to also learn about other solutions being developed, meet new people, and also more networking events that will be hosted by the HealthTech Hub. Yeah, and I didn't mention that, but with also the new components we are bringing up, like the standards and interoperability lab, we will also give you more updates later, but we hope you will be the ones benefiting from such components, because that's something that mostly addresses health tech solutions within the data sector. So stay tuned. We'll give you more updates, and reach out if you have any question or need any support. Thank you so much.
Thank you, Olivier.
Thank you, Olivier.
Thank you. Bye-bye.
Thank you. Bye-bye.
I'm still.